Hello everyone. I'm going to present my case study. The patient I chose was very close and it allowed me to have enough time, the appropriate amount of time to ask questions and to get in depth of her medical history and all the medication she currently takes. It also allowed me to teach her in person, providing enough effective teaching. Moreover, the patient had multiple medications they were taking concurrently, implicating possible drug interactions they are unaware of. Currently, the patient takes a levothyroxine tablet for hypothyroidism daily. She also has a transdermal patch with a combination of estradiol and northyronidone as hormone replacement after her hysterectomy. This is changed 2 times a week. Throughout the presentation, I will be referring to this as a combi patch. She also takes Excedrin extra strength oral tablet for her migraines, ibuprofen oral tablet for arthritis and sciatica, and 2 chewable tablets of calcium carbonate for acid reflux. After talking to the patient, I identified client medication learning needs that needed to be addressed. The patient needed to be educated on correct administration of her medication. Firstly, she was not aware of the importance of taking levothyroxine at a consistent time. I explained to her that levothyroxine needed to be taken at a consistent time, preferably in the morning and an empty stomach, 30-60 minutes before breakfast. To keep a consistent time frame with the levothyroxine, I suggest getting a pill box and keep it at her bedside, since she gets up at a consistent time each morning to take her child to school. Thus, she could take it the moment she wakes up when getting ready. To help her remember and not feel overwhelmed with the information I was giving her, we wrote down her schedule to take levothyroxine at 7 a.m., the time that she wakes up. She states that it typically takes her 30 to 35 minutes to get ready, where I explained to her it'd be okay afterwards to eat breakfast. Moreover, the patient reported taking her levothyroxine with coffee every day because it was convenient. I explained to her that she should not take levothyroxine with her cup of coffee in the morning because it interferes with the absorption of levothyroxine in the GI. Instead, she should swallow the tablet with at least 6 to 8 ounces of water. Additionally, the patient needed to be educated on drug interactions with levothyroxine, such as antacids. I emphasize that antacids can decrease the effectiveness of levothyroxine and avoid taking them after taking levothyroxine for 4 hours. Furthermore, she was not aware of the serious adverse effects of levothyroxine, such as signs of hyperthyroidism. I explained to her that side effects of levothyroxine overdose can cause hyperthyroidism, and she should look out for symptoms of tachycardia, palpitations, anxiety, irritability, insomnia, tremors, unexplained weight loss, vomiting, diarrhea, excessive sweating, and heat intolerance. I stated that she should notify her health provider if she does feel chest pain, weight loss, anxiety, and tremors. Additionally, the patient needed to be re-educated on how to apply a new combi patch, such as cleaning and removing old residue from the old patch before applying her new one. Luckily, the time of teaching fell on the date the patient needed to change her combi patch, which allowed for a great opportunity to have her act out the process as I teach and guide her as she applies a new one. I taught her how to remove the old patch and prepare the site for a new one by removing dirt and old medication using warm water and soap to dry the area and place the patch. Moreover, the patient reported not complying with their combi patch medication schedule, often forgetting to replace the patch 2 times a week. To help her remember to remove her patch 2 times each week, I helped her set up a calendar reminder on her phone to get notifications and remind her when she needs to replace her patches. Finally, the patient reported occasionally taking Excedrin and ibuprofen together. I stressed the dangers of co-administrating Excedrin and ibuprofen that can cause an increased risk of GI bleeding, and you should generally avoid taking them together. Overall, the patient was willing to learn and was cooperative with teaching sessions. She reported feeling a little overwhelmed when teaching about the side effects of levothyroxine overdose and remembering the symptoms and having to remember her schedule. However, she said it was very helpful that I wrote down the information for her to remember and keep for later on. Throughout the teaching session, I noticed that the patient was very responsive to teaching when I explained to her the reasoning why. For example, she was as apprehensive and confused about why she needed to wait 30 minutes to eat breakfast after taking levothyroxine. However, once I explained to her why, the patient was willing to listen after I explained to her that stating that some food could decrease levothyroxine absorption. The patient was a little combative with me about Excedrin and ibuprofen, about having to not take Excedrin and ibuprofen at the same time, feeling that she doesn't want to have to worry about feeling pain all day. So I did additional additional research to find that she could take ibuprofen at least 30 minutes after taking ibuprofen according to the FDA. Afterwards, she was more agreeable with that information and the teaching furthermore afterwards. Ultimately, one thing I learned during this case study is that patients are not trying to be difficult just to be difficult when you're trying to teach and change their routines. They want to understand why and are willing to listen if you take the time and explain to them. In doing so, you can help improve their health outcomes. This is the end of my case study, and thank you for listening.